Hello and welcome back to my channel. My name is Molly. I am a healthcare business consultant. So today I'm going to be touching bases on PHE, and it's going to be ending on May 11th of this year, 2023. For those of you who do not know what PHE means, it means public health emergency. So they're going to be setting some provisions on what's going to be ending on May 11th. So key highlights. So significant changes in payments for COVID-19 related services. Also, there are going to be significant changes in how hospitals and health systems could use expansion sites for the care of COVID-19 patients or to keep non-COVID positive patients isolated. Also, the return of regulatory requirements that were waived to ease burdens on healthcare systems, allowing staff to focus on caring for COVID-19 patients or within the past year of the pandemic, which is like the influenza and RSV. Also, they're going to be varying an implementation timelines for reinstating regulatory requirements and other operational changes. So let's get into, there are about 12 related provisions for the May 11th ending of PHE. The first one is going to be the use of temporary expansion sites. As you know, during the COVID-19 pandemic, the hospitals were overcrowded, so they had, did extended buildings. Well, they extended services through like vacant stores, buildings, convention centers, and also to like certain medical building suites they would rent out for COVID-19 patients. So that's going to be taken away as well. Number two, the use of provider-based departments that were relocated to settings outside the hospital, including patients' homes after receipt of circumstances waiver, and how they provided education and therapy services to hospital for outpatients. Number three is skilled nursing facilities. The beds that were available for patients for not meeting skilled nursing facility requirements. Number four is the EMTALA waiver that was allowing hospitals, to redirect patients from their emergency departments to screening tents for COVID-19 testing. Number five is the flexibility on limit of 25 beds for critical access hospitals and the 96-hour rule for average length of stay. Number six, reduced information requirements for post-acute care discharge to a skilled nursing facility, rehab centers, and long-term care hospitals or home health agency. Number seven, flexibility to have a separate nursing plan of care for each patient. Number eight, permission from the Drug Enforcement Agency to prescribe controlled substances without an in-person visit. Number nine is Medicare's 20% add-on payments for patients diagnosed with COVID-19 to offset the cost of complex COVID-19 patient care. Number 10, free COVID-19 at-home test and no cost sharing for testing services at therapeutics for Medicare beneficiaries, including those in a Medicare Advantage plan enrolled in private coverage. So after the PHE ends, patient cost sharing will be required, except for Medicaid beneficiaries who have at least an additional year of testing and therapeutic access at no cost. Additionally, Medicare will continue to pay $40 for COVID-19 vaccines administered in outpatient settings through December 31st, 2023. Number 11, state option to provide Medicaid eligibility for certain uninsured individuals to cover COVID-19 testing related services, vaccination and treatment coverage at 100% federal match. And the last one is number 12, health plan requirements to reimburse out-of-network providers for COVID-19 vaccines and testing. So I just wanted to put that out there for those 12 related provisions that's going to be ending on May 11th of 2023. So I tell the consumers, make sure you check with your health insurance plans to see what's going to be covered prior to this ending and what's going to be covered after the provisions ending after May 11th. Because you don't want to be blindsided by charges, related to COVID-19. And as I mentioned in those 12 provisions, that the government would no longer be supplying free COVID-19 at-home testing kits. So I would suggest that all consumers go online and apply for a free COVID testing at-home kit. I'm going to have the website listed at the end of this video. Then you can go click on there and just put your first and last name, your home address or apartment number, and your email address. And usually it ships within maybe 5 to 6 business days. I know because I have applied for a few and they came, like I said, between 5 and 6 business days. So that concludes this video for today. I hope that this helps, my consumers out there and also to my workers that are in the healthcare field. Again, if you like this video, please give it a thumbs up and subscribe to my channel. I'm more than welcome to comments and suggestions as well to my channel. And also check out my Instagram, which is linked in my bio. And I also have a Facebook page as well. So that concludes this video today. Thank you so much for the support, and I will see you in the next one. Bye.